joined us, Representative Oberlander, Representative Mostello, and Representative Todd Polinchuk has also joined us. Okay, with that, Marion Baldini, who's the President and CEO of KenCrest, you can begin whenever you'd like.
Good morning, and thank you for the opportunity to speak today. I'll talk really fast and try not to go over the limit. My name is Marion Baldini. I started working in the field with directions from my grandmother that all people with intellectual and developmental disabilities belonged in the community. I have over 45 years of leadership in this field and currently serve as the CEO of KenCrest. For over 114 years, KenCrest has served the community. Most of those years were dedicated to supporting children who were not developing as expected and supporting adults with intellectual disabilities. We serve over 12,500 people on an annual basis. 150 community group homes are in our scope of business. Our mission is to help serve people to thrive as our neighbors with or near their families and receive support in their own homes through positive person-centered approaches. Throughout my career, I've been responsible for transitions for multiple institutions, including Elwyn, Pennhurst, Embryville, and the Hamburg Center. The teams I have led invested countless hours to ensure that these transitions have been impactful and effective. It's been more than a few years since we started the work in support of the transition of the residents at Hamburg Center. Of specific interest to the Department of Developmental Programs was our success in supporting individuals with significant health concerns. At that time, KenCrest operated 4 highly specialized homes for individuals with complex medical needs requiring 24/7 nursing care. Those were for children or adults. The process that was rolled out by the department engaged us right away in meeting and speaking with families. We were directed that proposals would be required, which would show our interest and our capacity to serve the individual in their lives, and those families would need to approve those proposals to move forward. We shared our capacity to serve, and we want you to know the specific responses of the families as we first started working with them. One family was immediately interested in the proposal. The balance of the families were not. Most were skeptical. A few were willing to see what we could offer directly for themselves. Others were interested in the opinion of the social worker with whom they had a trusted relationship at Hamburg. So either the family or the trusted social worker visited our homes. All of the families who saw what we had to offer, consulted with the social worker, agreed to review our proposals. Those proposals took many hours to develop as we got to know the individual's needs, talk with the staff, review their records, and become truly confident that we could make a difference in those folks' lives. We drafted 10 proposals. 8 of those proposals were accepted by the families. After we reviewed those proposals and had them accepted, we deployed staff of nurses and professionals to continue to visit these individuals and follow them along with the Hamburg staff to make sure that we could continue to meet those needs. And that assured both the KenCrest leadership and ODP that we would be current when those individuals were ready and their homes were prepared for them. Since then, many of these individuals have progressed in their health and social interactions, and we're discovering their interests every day. The community has rallied around them. All of those residents have strengthened their connections with their families. We're expecting trick-or-treaters again soon at all of our homes, and we give out candy while encouraging and educating our neighbors on the care that is being provided for each of these individuals, and to show the value of the life of people who are different but important to all of us. We know how to staff these homes. We have nurses 24/7. We have a primary physician who got to know them while they were at Hamburg, who continues to make the old-fashioned house call as needed. We know how to adapt environments to support complex needs and how to make a welcoming home with a few things like a track system for barrier-free support. I understand that weighing of conflicting interests is difficult, but I have to tell you that some of the choices that we have today were not available when these folks originally went to these institutions. I have lost track of the number of parents who told me during my career that they were advised that an institution was the right choice or the only choice, and in fact, in those days it was true. We have learned and developed since then, and we know the real value of inclusion. What matters most in transition planning now is learning, discovering what is possible, and mobilizing our resources to create something special. We accept that responsibility to ensure that everyone is in our care has quality no matter what their ability. and supporting people to live out their lives in the most meaningful and fulfilling way. And this is by pursuing a choice and knowing what those choices are, which means immersing people into community and a place close enough for their family to spend time with them. We were excited to hear that the staff who supported the Hamburg transition from ODP were going to continue to provide the same supports to the families of Polk and Whitehaven folks. We invite the members of the committee to visit Kencrest community homes that specialize in people with medical needs. Over the past year, we've had multiple legislators visit these homes, and each was extremely impressed with the high level of quality. On behalf of Kencrest, thank you for listening and for allowing me time to lend the voice of success for those people who are now living as our neighbors.
Okay, Marion, thank you. And next, Gary Blumenthal is the Vice President, Government Relations and Advocacy for Envision Human Services. Gary?
Thank you, Mr. Chair, Madam Chair, and other assorted chairs.